Thank you for joining our Emergency Preparedness Communications Plan Training and Testing. This is the third session of our three-part series of Back to Basics with Emergency Preparedness. I'm Sherilyn Schaefer, here to present, and with me is also Tammy Henning. I will turn it over to Tammy Henning to begin the information. Thank you.
Thank you, Sherilyn. Welcome to part 3 of Basics of Emergency Preparedness. Next slide, please. We are your iPro QIN-QIO, which consists of health-centric advisors, which covers all of New England, iPro, which covers New York, New Jersey, and Ohio, and Clarent, which covers Maryland, Delaware, and Washington, D.C. Next slide, please. Today, we will be focusing on communication and testing and training. The learning objectives for this presentation are to review the federal requirements for the Emergency Preparedness Plan related to communications planning, review the federal requirements for the Emergency Preparedness Plan related to training and testing, discuss the survey process for reviewing the emergency plan, as well as discussing the importance of updating contacts. Next slide, please. The long-term care facility must develop and maintain an emergency preparedness plan that must be reviewed and updated annually. The plan must do all of the following: be based on and include a documented facility-based and community-based risk assessment, utilizing an all hazards approach, including missing residents and emerging infectious diseases. Include strategies for addressing emergency events identified by the risk assessment, address resident population, including but not limited to persons at risk, the type of services the long-term care facility can provide in an emergency, and continuity of operations, including delegations of authority and succession plans, and include a process for cooperation and collaboration with local, tribal, regional, state, or federal emergency preparedness officials' efforts to maintain an integrated response during a disaster or emergency situation. Next slide, please. Again, the 4 parts of the Emergency Preparedness Plan are risk assessment, policies and procedures, and today's focus, the communication plan and training and testing. Next slide, please. The regulation states the facility must develop and maintain an emergency communication plan that must comply with federal, state, and local laws. 2 requirements listed are that they must be written and they must be reviewed annually. Next slide, please. So make sure the communication plan is a written part of your emergency plan. Make sure all annual reviews are documented to show updates. And be prepared to verbally explain how the facility collaborates with federal, state, and local officials. Next slide, please. Surveyors may ask if contacts are completed and updated at least annually. Who is assigned to keep this information updated and accurate? And do you have a way to access this information off-site during an emergency? Next slide, please. Verify that contacts for all of the entities above are updated regularly. These are federal, state, tribal, regional, and local emergency staff, state licensing and certification agencies, the Office of the State Long-Term Care Ombudsman, and any other sources for assistance. For emergency management contacts, you may not have a specific person, but you must have a specific phone line or contact method. Next slide, please. Do you have multiple methods of communicating? Landlines and cell phones? How do you communicate within the building? Is this part of the risk assessment, which should be addressed in your emergency plan? Next slide, please. Facilities need to address alternate communication methods. Do you have alternate ways to communicate during a loss of power? Is this documented in the procedures? Remember, while talking on walkie-talkies, to abide by HIPAA regulations. They are not a secure source of communication. Next slide, please. Make sure you have a policy and procedure that addresses the means the facility will use to release patient information to include the general condition and location of patients. If information is online, do you have the ability to access information if you lose power and internet? Next slide, please. Where do you store backup food supplies for food, water, and medical supplies? Do you have sufficient supplies for staff and residents and volunteers? Be aware that the regulations can vary by state. Next slide, please. How do you communicate your emergency plan with residents and families and staff? Who reviews this with each new resident? Each facility decides what is appropriate. Do you have a fact sheet, a brochure? What do you give to residents and families? Next slide, please. Do you have a process and documentation that this information was shared if requested? How do you communicate the plan? And will staff, residents, and families say they received it? Okay, and this wraps up the segment on communications. I'll now turn the presentation over to Sherlyn to cover training and testing.
Okay, now that we move on to training and testing, the facility must develop and maintain an emergency preparedness training and testing program that is based on the emergency plan, your risk assessment, policies and procedures, and communication plan. The training and testing program must be reviewed and updated at least annually. Next slide. Surveyors may verify that the facility has a written training and testing program that meets the requirements of regulation. They can refer back to the facility's risk assessment to determine if the training and testing program is reflecting risks and hazards identified within the facility's program. Make sure you cross-reference your hazards when doing your training. Do you have procedures for each of the hazards that you identified? Verify the program has been reviewed and updated at least annually by asking for documentation of annual review as well as any updates made. Verify the plans meet the requirements for evacuation drills and training. Next slide. The facility must complete a training program. The initial training and emergency preparedness policies and procedures to all new and existing staff, individuals providing services under arrangement, and volunteers consistent with their expected roles. Provide emergency preparedness training at least annually. Maintain documentation of all emergency preparedness training. Demonstrate the staff knowledge of emergency procedures. What emergency preparedness training is provided to agency staff? Do they receive prior to start to their shift? Make sure you have training fact sheets or review your emergency process during your planning with each of your staff members. And don't forget those that the agency staff that are there in all shifts. Next slide. Testing. The facility must conduct exercises to test the emergency plan at least twice per year, including unannounced staff drills using the emergency procedures. Participate in an annual full-scale exercise that is community-based, or when a community-based exercise is not accessible, conduct an annual individual facility-based functional exercise. Next slide. If the facility experiences an actual natural or man-made emergency that requires activation of emergency plan, facility is exempt from engaging its next required full-scale community-based or individual facility-based functional exercise following the onset of the emergency event. For your next drill, conduct an additional annual exercise that may include, but is not limited to, the following: a second full-scale exercise that is community-based or individual facility-based functional exercise, or a mock disaster drill. Next slide. A tabletop exercise or workshop that is led by a facilitator includes a group discussion using a narrated, clinically relevant emergency scenario and a set of problem statements, directed messages, or prepared questions designed to challenge an emergency plan. Example, if you had an area flood or a pipe burst and you enacted your emergency plan, this can be considered a full-scale drill as long as you completed the process. Your facility then would need to do another full-scale or tabletop drill to meet the 2 drills per year. The facility should analyze their response to and maintain documentation of all drills, tabletop exercises, and emergency events. If you revise the facility's emergency plan as needed, reminder, if you revise your plan, make sure your staff are educated on these changes and that you have documented this education. Next slide. Facilities must document efforts to identify a full-scale community-based exercise. If they did not participate in one, you need the date, the personnel and agencies contacted, and the reasons for the inability to participate in a community-based exercise. Request documentation of facilities analysis and response and how the facilities updated its emergency program based on this analysis. It is recommended that you maintain a minimum of 2 past cycles of your documentation, but this is based on your retention policy at the facility. Next slide. Testing after public health emergency, the PHE. There are the QSO 23-13-all will discuss, the full-scale exercise and the annual cycle. Per this QSO, the CMS regulation for emergency preparedness require that providers to conduct exercises to test their EP plan to ensure that it works and that staff are trained appropriately about their roles and provider processes. If you have not completed a full-scale exercise in 2023, you will need to complete one by the end of 2023. You still meet the 2 training sessions per year for the 2023. So just remember that even though there's the expiration and it expired in May, that you still will need to make sure you meet your training sessions for 2 per year. Next slide. Surveyors may ask facility leadership to explain the participation of management and staff during scheduled exercises. They can also ask to see the documentation of these exercises. Documentation must demonstrate the facility has conducted the exercises described in the standard. Always document drills or actual preparations for actual emergencies. Take credit for the planning and work that you do. If you have had any type of emergency, smoke in the building, we've had lots of storms recently, and in your preparation for those storms, what did you do? Take credit for that process that you put in place. Next slide. Emergency and standby power systems. The facility must implement emergency and standby power systems based on the emergency plan. Emergency generator location. If new structure or change in location, the generator must be located in accordance with the location requirements found in the Healthcare Facilities Code NFPA 99. The emergency generator inspection and testing facility must implement the emergency power system inspection, testing, and maintenance requirements found in Healthcare Facilities Code, NFPA 110, and Life Safety Code. So make sure that your maintenance director or whoever has copies and can access these codes. If you are using your emergency generator during an emergency, do you have enough fuel if you run under full power for several days? Facilities that maintain an on-site fuel source to power emergency generators must have a plan for how it will keep emergency power. systems are operational during emergency unless it evacuates. So questions to think about. What happens if your generator malfunctions? Do you have a backup system or contract with someone who can deliver a temporary generator within hours? Because it will take hours to get another generator large enough to cover the areas you need to cover. Plan for each of these potential emergencies or scenarios. Also remember that if you lose power, many states require you to contact your state agencies within so many hours after you've been without power for so many hours and you've been on your generator. So know your state's regulations and who you need to contact and what the numbers or the sites that you need to contact. Next slide. The surveyors may verify the facility has the required emergency and standby power systems to meet the requirements of the facility's emergency plan and corresponding policies and procedures. Review the emergency plan for shelter in place and evacuation plans. Based on those plans, does the facility have emergency power systems or plans in place to maintain a safe operations while sheltering in place? Remember, your temperatures and everything has to be set temperatures even though you're sheltering in place and you are on emergency power. From my personal experience, during a federal survey, the surveyor spent several days reviewing the emergency plan and questioning me, the administrator, and other leaders. So understand the plan and be prepared for questions. The last 3 sessions were to give you an overview of emergency plans back to basics. We have developed a comprehensive checklist that is based on the State Operations Manual, the Appendix Z, Emergency Preparedness for all providers. The list is concentrated for long-term care. We will have that out to you as soon as it goes through the proper channels for communications. If there is any area or topic that you would like additional information, please let us know. We can assist one-to-one or provide information through additional education sessions. Next slide. Through the QIN-QIO, we have multiple people who can assist in various areas. We have HealthCentrics, iPro, and Clarent. There is a contact sheet that you can reach out to anyone on this list and they can assist you. Next slide. Your emergency preparedness team is Tammy Henning, myself, Sherlyn Schaefer, and Tracy Pate. If you have any questions, we have provided you with the email addresses. Please reach out and contact us if you have any questions. We hope you have enjoyed this session and the other 2 sessions. Look forward to more emergency preparedness educational sessions to come. Thank you.